Okay. I'm going to try one more time. One more time. I'm trying one more time. Yeah. God, something's really weird. Do I have a virus? I wonder if I have a virus. My computer is shit in the bed. My computer is shit in the bed. I wonder. Wait, where am I? Wait, where'd it go? Where is my Discord pulling up? Uh-oh. What's going on? What's going on? Third time a charm? I don't know. I'm trying. The sound. Lost the sound. Okay, hold on. Are you guys here? I don't even know if you're really here. Oh my god. Wait, let me just see. Oh, I guess I can't pull up I'm not going to try to pull up Discord because that's probably going to fuck things up. All right, we're going to try. We're going to try. What's going on is you're amazing. Hi, Good Trouble. Hi. On the third stream. The third time's a charm. I don't know what happened. I got this weird, like, computer looking message. You know, not like a blue screen, but like the computer that says, your thing. I wish I should have taken a picture of it. I can't remember what it said now. Unable to do that function. Conjunction, junction, what's your function? Do. Thank you so much, Meowing Star. I was trying to get into Discord, but my Discord won't even open, which is kind of bizarre.
I needed to fire them, promote the next group, and continue
Is
to
this
do
my
so
computer?
until I got to an organization that was compliant with
My
my demands.
God.
So the plan was to literally just kind of keep firing until there was somebody in that position that was willing to go along with what Secretary Kennedy was asking. Is that right?
That is what he communicated to me, yes.
I guess I wanted to just ask you, are you aware if this type of practice and this kind of order is given to other parts of HHS, FDA, NIH, any other parts?
He had said, although I have no means to verify this, that others at FDA
technology
were engaging in this practice.
I raised that, Mr. Chairman, I think, we're raising concerns about what's happening with regards to the CDC, but as mentioned, we're hearing
I'm not
potential
sure what the fuck is wrong with the
allegations
audio.
that, this type of action is taking part in other parts of HHS, and I hope this committee can try to follow up on that. Dr. Monarez, you said something in your testimony that caught my attention, which is you said something to the effect of that your political staff had to approve of policies and personnel decisions that you were trying to make. Is that correct?
That is correct, and that was the email that has
Oh my
apparently now
God,
been
we're back with horrible
made
sound,
available
Neil.
through the Washington Post.
And so when you talked with Secretary Kennedy, he talked about wanting to have you fire. He also talked about, you talked about him ordering you to pre-approve decisions made by the ACIP. When Kennedy was asked about that last week, he said, quote, "No, I did not say that to her. I never had a private meeting with her. There were other witnesses that will say, I never said that." I guess I'm just asking you, who else was in these meetings with you?
So the meeting where that was first stated and the request, the demand made of me, included 5 other participants in addition to the secretary. It included his deputy, the deputy secretary, his chief of staff, the deputy chief.
Will you please give names? I'm sorry.
Yes, sorry. The Deputy Secretary, Jim O'Neill, the Chief of Staff, Matt Buckham, the Deputy Chief of Staff, Stephanie Spear, a member of the General Counsel staff, Bob Foster, and a member of his council staff, Ken Callahan.
I think what really stands out to me is this question, if he's not listening to you, if he's not listening to CDC career staff and experts, the question is, who is Secretary Kennedy listening to about these important decisions that are before us? And not only just the idea of listening, but both of you have addressed this in so many different ways. I mean, Dr. Monarez, you talked about how they were, when you were talking to Secretary, he was basically telling you that the child vaccine schedule will change in September. Is that roughly right?
That is correct.
That's the idea that it was going to happen, not likely to happen in September.
Going to happen.
And Dr. Oury, you talked about this in so many ways, and I think the phrase that really stood out to me with your work was you said it was about pre-decided outcomes of votes. Is that correct? Is that what you were worried about?
Yes.
Because what we're seeing as well is this, we're seeing this over and over again where it feels like there's already a decision that's been made. And now we're trying to figure out how to twist the data to be able to meet that prediction or meet that assertion. Is that correct, Dr. Oury?
It is, and I think my concern is, President Trump issued the executive order on gold standard science, and I believe in that. We should have data that you can replicate, that you can understand, and we were put in positions to where I am concerned that the science coming out won't be gold standard science. David Geyer, who the senator or secretary testified, was a contractor, was brought to CDC, and I had the deputy policy chief of staff of HHS come meet with myself and the other 3 leaders who resigned, Drs. Jernigan, Daskalakis, and Layden. And for 2 days, she sat with us and asked us to grant access to a data that has privacy and security concerns to this researcher.
No, I appreciate you raising that, and just what we've seen in terms of how they've talked about this with the VSD. A lot of concerns, and I think there's a lot more this committee needs to do to look into that. Thank you, and I yield back.
For the record, it's just been reported that Senator Mullen told reporters that he was mistaken in saying that the RFK Jr. meeting was recorded. But in case he's mistaken that he was mistaken, if there is a recording, it should be released. And it would beg the question of what other conversations were recorded. And I'll repeat what I said earlier.
Liar.
We have sent a request to HHS for records related to these incidences. We've yet to receive those, but of course it would help the committee, which on both sides has found itself scratching its head. It'd help us kind of discern what the truth is. With that, I go to.
Oh, you really
Senator
wonder what the
Alston-Brooks.
truth is?
Thank you so much.
Are you
Good
kidding?
afternoon, Dr. Menares, and good afternoon, Dr. Howry. First of all, I want to thank you for being here today. This is a charged political environment, and being here today took courage. So I want to thank you for your courage. I also want to thank you for your commitment to the truth. Speaking of the truth, today it's been mentioned that there was a, quote, honest problem or honesty problem. Secretary Kennedy in this very room said that he would not fire scientists who were career scientists or working scientists, and he lied when he said that. And so I want to just question first, Dr. Menares, I want to talk to you about the series of things that happened on August 25th. You've described the meeting as animated. I will say it sounded unhinged. But I want to ask you whether Secretary Kennedy, what rationale did he give you for firing career scientists? What did he say the rationale would be?
Yeah, I mean, that was a sequence of events where he had articulated his longstanding concerns related to the CDC, and that the career scientists were part of a group that was part of the most corrupt federal agency in the history of the world, and a number of different items that he had.
That doesn't
ticked off,
sound made
including
up.
that
That sounds
CDC
like something
employees
he
were
would
killing
say.
Children and were bought by the pharmaceutical industry and forced people to wear masks and social distancing. So there was a number of different contextual items that he offered related to why those CDC scientists should be fired.
And during that unhinged conversation on August 25th, did he also indicate that he had asked leaders at other agencies within HHS to carry out similar directives to fire scientists and senior officials?
He didn't use the word scientists or senior officials, but he did say that others, and I have, again, no way to substantiate this, but that others at the other their organizations, FDA, CMS, and NIH, were engaging in a similar practice of turning over leadership and getting to an organization that would be aligned with his priorities.
So in other words, substituting scientists with people who would rubber stamp his views and opinions.
So he didn't use those exact words, but the idea was to get to an organization that would be aligned and compliant with his administration priorities.
Now, how did he tell you, again, how you should comport yourself with political staff or more specifically his allies? What did he tell you about that?
He said that I needed to surround myself with the politicals and that I needed to listen to them and that I needed to support them with everything that they needed. and that I did not need to engage with any of the career scientists.
And again, just so we're reminded, where were you immediately prior to this meeting?
Immediately prior to this hearing today?
Yeah, well, to the meeting on the 25th.
Oh, I'm sorry. Yep. I was, the previous week I had spent in Atlanta with the CDC staff post the shooting, doing a number of activities to make sure that I could ensure their security, help them with the healing process, and then continue the CDC mission.
So I want to ask you very quickly about that. At 5 p.m. on August 8th, a gunman opened fire at the CDC headquarters campus in Atlanta, Georgia, forcing thousands on the campus to lock down. Now, did you receive a call from the secretary upon the first reports that an active shooter on CDC headquarters had shot at employees?
I did not speak to the secretary on the 8th or any successive day. I did not speak to the secretary until August 11th when he came down to visit.
So are you telling me that the Secretary of Health and Human Services failed to even give you a courtesy call upon learning that employees there had been shot at?
He did not call me.
I want to ask Dr. Howery very directly, do you believe that Secretary Kennedy is incompetent and dangerous to the American people's health?
I always believe in optimism and hope, and I would say that was my hope when he started. I'd read his books, and as a transition lead, I was prepared to welcome him. After seeing his Senate finance testimony and the number of misstatements, seeing what he has asked our scientists to do and to compromise our integrity, and the children that have died under his watch, I think he should resign.
And finally, I just want to use the last 20 seconds or so I have, Dr. Menarez. You've said you agree with the president that vaccines are not controversial because they work. And I am a mother. You are a mother. I would like you to take the last few seconds I have to talk to parents. My greatest concern would be confused parents who have kids who are going to kindergarten, going to daycare. What do you say in this moment about these parents, and what should they do regarding vaccines?
Vaccines are safe, they're life-saving, and I would encourage any parent who is concerned about whether or not their child should get a vaccine to talk to their pediatrician, to understand the benefits of these life-saving medical products, and to make the best decision that they can to make sure that their children remain healthy and happy and can go to school and be safe.
Thank you both so much for your integrity and for being here today. Thank you.
Thank you, Senator Alsobrooks. I would now request unanimous consent to submit a article for the record. Dr. Menarez told us that Secretary Kennedy urged her to speak to Aaron Siri, and this article says, the title is, Anti-Vaccine Group with Ties to RFK Jr. Saw Another Windfall Last Year, Record Show, and it points out that $6 million was paid to his law firm to pursue public records requests, et cetera, and $20 million at times past. Secretary Kennedy has been an advisor to this law firm in the past. I have a couple questions. Dr. Ori.
Gosh, Cassidy seems a little sad.
You said that Stuart Burns said
Oh, probably
that
not in Canada.
CDC's systematic review, I think on birth dose hepatitis B, correct, was biased. Did he share any alternative evidence to support his views?
He had said that the questions we had posed could lead to bias. We had not developed a systematic review at that time.
And what did he ask you to do with the evidence you accumulated?
So he suggested 70 additional papers that had come from the Vaccine Compensation Fund, including some that were in French and Indian.
That were what?
They were in other languages that we could not then incorporate into the systematic review. I explained, as did the acting center director, that we have a systematic process we follow. The library was polling the evidence for us, and we couldn't speak to the data as we didn't have the data yet, and questions shouldn't bias. Questions provide answers.
And you said, so did you have to pull what happened with the review you did?
I'm confused.
It is underway. I don't know if it was completed because I left 3 weeks ago.
And what happened with the review he did with references in Hindi, for example?
So he didn't do a review of hepatitis B, he sent 70 references for the scientists to include. I don't know if they were included. I said if they had valid methods, they would be.
Do you know if Stewart was representing the Secretary's viewpoint?
I believe he was, because he told me that the secretary had suggested age 4.
Say that again, I'm sorry.
He had said that the secretary, as had an HHS counselor to me, suggested the secretary wanted the birth dose moved.
Okay. I'm sorry, my alarm's going off, so let me just do this so it's not distracting. And so,
Cute phone case.
as I close, I'm going to speak
Cassidy.
as a
You feel stupid
No.
now, Cassidy?
a point of personal privilege to address the ACIP meeting scheduled for tomorrow. Folks know I'm a physician. As it turns out, I am a hepatologist, which is a liver specialist, and have published papers on liver disease and have seen people die from hepatitis. That was my practice of how do you teach students how to avoid this and how do you treat the patients that have it. Now, we've heard allegations related to ACIP here today that will need to be addressed. I don't prejudge. I don't know if you're telling the truth or not. And when Secretary Kennedy comes, I'm keeping an open mind. Let me just say that. But I know it's our responsibility and it's our mandate from the President of the United States that we have radical transparency. And I thank the two of you for taking the risk to your personal life to come today. Anything less than radical transparency betrays the trust the American people have given to us and betrays the mandate the President has delivered. One thing that reportedly is going to be discussed at the upcoming ACIP meeting is ending the recommendation for the birth dose of hepatitis B vaccine. Now again, this was my practice for 20 years before I entered politics. More than 90% of infants, let me start over. For those who say, why should a child be vaccinated for a sexually transmitted disease when they're at birth? The child passes through the birth canal and is exposed to the same secretions as one would otherwise. And that passage through the birth canal makes that child vulnerable to the virus being transmitted. Not just hepatitis B, it can be HIV, it can be other things. But in terms of hepatitis B, that happens. If that child is infected at birth, more than 90% of them develop chronic lifelong infection. Now, we'll talk about the consequences of that in a second. Before 1991, as many as 20,000 babies were infected with hepatitis B in the United States of America. And that changed when the hepatitis B vaccine was approved for newborns. And by the way, as Dr. Menarez says, this doesn't mandate. It doesn't say you can't leave the hospital unless you get it. It just says that if the mother accepts, then the insurance company has to pay. It's not mandated. It's just like, mama, if you think it's a good idea, accept it. In the decade following approval of a birth dose of hepatitis B, newborn infection of hepatitis B reduced by 68%. That's in the decade.
Gosh, that
That's
sounds
up to
like data.
2001. Now, fewer than 20 babies per year get hepatitis B from their mother. That is an accomplishment to make America healthy again. And we should stand up and salute the people that made that decision. Because there's people who would otherwise be dead if those mothers were not given that option to have their child vaccinated. Now, by the way, there's some who said they've never seen it, so therefore it cannot exist. I want to submit for the record a link to an X thread in which Dr. James Wong from California shares his personal information. This doctor, he was infected at birth. He developed cirrhosis. He almost died. Now, because of modern medicine, that hepatitis B virus is controlled. But he has to get screened regularly and lives with the specter of getting liver cancer because he got cirrhosis when he was infected as a baby. It does occur. It occurs less often now. So we can argue, now that we've controlled it, do we let the genie out of the bottle? If the recommendation goes away and a parent does want the vaccine, insurance will no longer cover it free of charge. She'll be forced to pay out of pocket. With that, this brings us to the conclusion. Any senator wishing to ask additional questions for the record, we do.
All
at 5 p.m.
right. Okay. Well, thank you, Dr. Cassidy. It's about time you grew some balls. Mark Wayne has a recording. How embarrassing. How fucking embarrassing. And I know he did it just to put her on the spot and see if he could catch her and create the sound, but that even makes it more disgusting. That even makes it more offensive. I mean, how if that was my representative or my senator, I would be on the phone. Like, you don't represent me. That's not how you represent your constituents. That's their fucking appointee that he's talking to, not some Democrat. That is a hand-picked fucking Republican appointee. Period. It's just so, I can't even. I don't, there's just no accountability for anyone in this world. I'm sorry. I know this is going to be like a stupid rant, but I just feel like the people that are that do shit to others, whether it's, YouTube streets or this kind of stuff, all the people who just act really shitty to other people just get by. Like, they get away with it. And I don't know, I mean, I guess it's not about, like, I don't know what I want to happen to them. You know what I mean? Like, that's not the point. But it's like, that's just gross. It's just gross. As you stop. As you stopped uncritically repeating. Yeah. I mean, I just can't. Hi, Carrie. I know we got kind of cut off. I don't know what's going on with my system. It seems like it was one of those weird failures. But it happened twice. I'm not sure. I've never seen that message before. I'm going to have to take a picture of it next time. But yeah, it's just like, God, that's just so angering. Anger, anger, anger. Ugh. I had plans to like do a longer show and like read this stuff to you, but I'm a little bit tired. Like I'm falling asleep. I think it's because I haven't gotten a lot of sleep in the last 2 days. So I apologize, but I think I'm going to cut it short today-ish. And I do promise that I have a lot of good things to read to you. So either we'll get to them tomorrow, or I'll have to schedule maybe a twice baked, so that we have some time to go through, because these articles are important and I want people to have a chance to listen to them. I know. I just need to kind of like regain my take care of some tiredness. But yeah, sorry. What a frustrating morning. God, I thought it was I thought it was going to be okay, but it just ended up being so frustrating. I know sleep is such a good thing. Sleep is good. But anyway, thank you so much for coming and spending some time. Sorry about the glitches and the technology issues today. That makes for a little bit of a frustrating viewing experience. But thank you for coming. And I will definitely see you tomorrow morning. Hopefully, if you can spend some time with me tomorrow morning. I'm really working, I'm trying to get my camera fixed. I think I have one little dongle thing coming today that I might be able to reroute the camera. So anyway, I'll work on that. Oh, thanks so much. I appreciate all the patience. I really do, because I know how it can feel on the other side. So I appreciate your patience. So yeah, have a great rest of your, what is today? Wednesday? And I will definitely see you tomorrow morning if you're around. And I hope you have a great day. Thanks again. Take care. And don't let the turkeys get you down. That's what my mom would have said. All right.